Open Your Eyes is brought to you by the Belize Bank. Our country, your bank.
Good morning. Welcome to Open Your Eyes, Start Your Morning Right. I'm Marlene Cuellar, and thank you for joining us this morning. It is a lovely Tuesday morning. Definitely look like it's gearing up to be a hot one, but we have quite a bit in store for you this morning that's going to get your day started off right. And of course, to start your day off right, we are going to get into some motivation to get you going. And that means it's time for Eye Opener. Or Eye Opener, taken from dailyom.com, goes like this. Being single or in a relationship are both valid options for living life. And one is not better than the other. The way we choose to love can be as unique as the way we choose to make a living, maintain our health, or entertain ourselves. Some choose to seek out a mate and enter into a partnership with a special individual, while others find immense satisfaction in staying single. There is no right or wrong way to be in your life when it comes to deciding whether or not to be in a relationship, even though society tends to put an emphasis on romantic partnerships. Whether you choose to go through life as part of a romantic relationship or live as a single unit, there are benefits to both. Feel free to be comfortable with whatever choice is right for you. Remember that what is right for one person may not be right for another, and people can transition between wanting to be with another person and wanting to be alone many times over the course of their lives. Whether you seek out a mate or live the single life, embracing it fully will ensure that either choice is as fulfilling as possible for you. All right. So there you go. Great eye-opener for this morning. And, I think especially when the eye-opener talks about the pressures that society tends to put on people as to what status you should have. And a lot of these are usually tied to age and what you should be doing. By X age, you should have the spouse and X children with the house and whatnot. But what it reminds us of is just how we all have an individual choice as to how we're going to live our lives. And whether that's single, whether that's in a relationship, whether you are fully committed, whether you are newly single, these are all different phases in your life that you will go through and that you must enjoy. You can't be sitting around wishing you were single if you're in a relationship. You have a choice there. And if you're single, lamenting over not having a relationship instead of enjoying the time you have to yourself doesn't do you any good either. So, our eye-opener is really a great way for us to put things back into perspective and recognize that these phases are all a part of what we'll go through, but most importantly, doesn't mean we can't enjoy it. So that is the eye-opener for today. And with that, we'll take a look at our weather for today. And our forecast provided by the National Met Service for today goes like this. The general situation is for a relatively moist easterly airflow to persist over the area. The 24-hour forecast is sunny with a few cloudy spells and partly cloudy tonight. Showers will be isolated, and there is the chance of isolated thunderstorms over the Toledo district. The winds are going to be moving from the east at 10 to 20 knots. Our sea state is moderate. Our high temperatures for today are 89 along the coast, 97 inland, and 84 in the hills. While for tonight, we're looking at 81 along the coast, 75 inland, and 68 in the hills. There is a heat advisory, especially for those inland, and they are advised to stay hydrated and avoid outdoor activity as much as possible. For Wednesday and Wednesday night, there is the forecast for a few showers and isolated thunderstorms. And we want to thank our forecaster, Angelia Guy, for preparing that update for us today. So it is going to be another hot day, but it seems that we may be expecting some showers. If you're in the south, you can definitely expect some. For the rest of us, that may be a few days away. All right, and now it's time for us to get moving into our show for today. And as promised, we have a great lineup for you. We're starting off by putting our COVID situation into perspective. We're going to be joined by the Minister of Health and Wellness to talk about the increase in cases of COVID-19. We know that there's a lot of concern about the cases detected in the south, in the north, and of course we're seeing a few more people being hospitalized. So we're going to put it into perspective and what are the plans moving forward in the first part of our show. And then Galen University is rolling out a new master's program, and this is going to be for a master's in development studies. We're going to be joined by the Dean of the Faculty of Art and Science and Technology to tell us more about this new program. And then we close off for today with a conversation with two female athletes who have received scholarships, athletic scholarships. So their athletic talent has led them to gain the opportunity to further their education. We'll find out how they were able to make use of these opportunities and what their hopes are moving forward. So that's what we have in store for you today. We're going to go ahead and take a break, and when we come back, we're going to be talking about the COVID-19 situation in Belize.
It's a fact that with Smart, you get truly unlimited everything. Only with Smart, you get unlimited data anytime, while with the other guy, it's only double data on weekends. With unlimited data every day with Smart, there's no need to wait. So, it's a fact that our unlimited plans beat the competition. Stop being measured and told when to use your data and get unlimited talk, text, and data. Experience the true unlimited plans with Smart. That's a fact. Make the switch and live smart.
Good morning, sweetie. It's time for school.
Are you a teacher or public sector employee who is thinking of owning your new home? Get the keys to your new home with Belize Bank's all-inclusive mortgage, the best financing option in Belize for your new home purchase or construction. Inclusive of all mortgage-related fees, no down payment, affordable terms, amazingly low interest rates. Visit our nearest branch to speak to one of our financial advisors to discuss how you can be one step closer to owning your new home. Some conditions apply.
Dwayne Moody, Isani Cayetano, Andrea Polanco, Paul Lopez. Your News 5 Belize teams do whatever it takes, go wherever they need to go, so you can catch the story wherever you are, whenever you want, on whatever device. Channel 5 Belize on television, Facebook, Instagram, and YouTube, because news is now everywhere, all the time. And so are we.
COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we're back, and we're moving into our COVID-19 update for today, brought to you by Fulltech Systems Limited, as we talk about the current situation of COVID-19 in the country. We're joined by Honorable Michelle Shabat, who is the Minister of Health and Wellness. Good morning. Good morning. Can you hear us? I think he froze just that moment.
Morning, my morning. A special morning to its entire Earth.
Yes.
Are we frozen? Are we back?
You are back, and we can hear you clearly.
Yes.
So,
good morning to you. Good morning, Belize, and especially to the fine folks in Kayonar. A very good morning to you all.
All right. So, Minister Shabat, let's just dive into the current situation that we're facing at this time. We've officially moved over the 100 mark with active cases. Give us the status update as to the situation.
Right. Well, currently we have 120 active cases, Marlene. Yesterday we had 38 new cases reported, with the majority of them coming out of the Stann Creek district. Right now we have one person in our ICU, and we have 4 other persons hospitalized. So I think what we've seen over the past week is a spike in numbers, and what is especially concerning for us, Marlene, is that we're seeing this among students and teachers. And this is of great concern for us. As you know, last week in Belize City, some of the schools were temporarily closed because some cases were detected. In the south, 3 schools have now closed to sanitize and to make sure that everyone in their schools are tested and so forth. But this is very concerning to us. And I'll tell you, we have reached out to the Minister of Education to discuss this matter and to discuss the way forward, because the number of cases we're seeing arising out of the schools is of great concern to us.
How many children have tested positive?
I don't have a count on the children themselves, Marlene.
Okay.
I don't have a count, but I know that yesterday another child in the south was also tested positive.
Okay. Now, let's talk about the schools that have been closed. You identified 3. There's the Santa Cruz Primary School.
Yeah, and the Independence High School, and I believe there's a Grace Primary School down there as well.
Okay.
I hope I hope I got that name correct.
Now, we've been talking about the increase of cases since the first cluster was detected at a casino in Belize City. Looking at it now, do we officially say that we're in a 3rd wave of COVID-19?
Not quite yet, because we have not seen what we call community spread. So far, we're seeing clusters, but we are seeing a trend. We're seeing a trend. We started off with the casino, where we had about 21 cases, and then we moved to the south, where we had an additional 21 cases. And I want to say also that we're looking at Orange Walk very closely, because we're seeing a spike there. One is related to a family situation, and the other one is in relation to one of the evangelical churches there. And so for us right now, the 2 hot spots are the Orange Walk district and the Stann Creek district.
So the cluster in Belize City, that time has passed, they've all recovered?
Well, they're all, if they have not recovered, they're on their way to recovery, but that has been contained.
Okay.
That has been definitely contained, and so that's a relief for us.
Yeah. Now, do we know the origin of these cases? In other words, where it was first introduced or how it was first introduced into these communities?
Well, I know that in the Stann Creek district, we have identified what the medical team calls index case, where it originated from. That person has been identified, Marlene, and that person is a staff member of the Santa Cruz school, no?
Now, what this does, of course, is, and I know you mentioned earlier that your next conversation is with the Minister of Education, but this was perhaps one of the first concerns from parents when there was the proposed reopening of schools. What does this mean now looking forward?
Marlene, obviously this has always been a concern for the Ministry of Health and Wellness. And obviously our call now, and has been for the last month, 2 months, is for our people to get vaccinated, particularly our teachers. I know there's a lot of resistance among the teachers to get vaccinated. However, the teachers have to realize that they have children in their care. And while the science shows that children, although they may not exhibit severe symptoms, children can also be carriers, and they can also contaminate parents when they go home, older parents and grandparents. And so it is of major concern, and it is very important for the teachers to get vaccinated. I don't know how it is possible for us to reopen fully our schools if our teachers are not vaccinated. And that is a conversation in which we're currently engaged with the Ministry of Education, Marlene.
What's the uptake for vaccination for teachers as of today?
The last numbers I saw was they were about 47%.
Okay.
Still very low, still very low.
Yeah.
You know, the Ministry of Education has given permission to over 200 schools to open. Yeah. And that does not take into account the additional numbers that will want to be opened when August comes around, between high school, primary school, sixth forms, and so on. And so there is a window of opportunity right now to make sure that all of our teachers get vaccinated, and I am appealing to them to do so.
Now, when we look at what's happening with COVID around the world, and other countries are moving into another wave or recovering from another wave, what we're seeing is that the new variants that have been detected are now affecting children. Has the Ministry of Health moved into planning as to how we're going to protect our children? Will they eventually be included in our vaccination rollout?
Yes, so in terms of variants, I can tell you that we have ongoing relationships with Galen University, and we send to them frequently some of our swabs to test to ensure that we do not have any other variant in the country. And so far from the reports we've gotten, there are no other variants apart from what we saw in January. In terms of vaccination of young people, you will know, Marlene, that Pfizer is one of the vaccines that has been approved for children between 12 to 18 years old. And so we are actively looking to see how we can acquire some. Obviously, the next stage of vaccination has to be that age group.
What phase are we right now at the rollout?
We're at phase 3. We are planning to open up phase 4 shortly, and I expect in the next couple of weeks that's going to happen.
Now, Minister, when one looks at the update coming out with the vaccination rollout, it is very clear that there is a decline from when we first started. The early reports in March, there were about 2,000 vaccinations a day. In the past week, some days there were about 500 vaccinations a day. Vaccine hesitancy is something that all across the world is being challenged. How are we fighting that here?
Yeah, Marlene, we started in the thousands when we just began per day, which was great. I can tell you that we're averaging anywhere between 500 to 600 on average. Yesterday we had a pretty good day. We had over 870 people vaccinated yesterday. Now, what we're doing is we're teaming up with some of our businesses to provide incentives to people who get out and get vaccinated. We're also looking to see, Marlene, how we can ease up, how we can allow people who have been fully vaccinated some other measures of freedom, so to speak, that those who have not yet been vaccinated will not be allowed to enjoy. And so we're looking at these things carefully. We're looking at how we can bring over that message to our people, the importance of the vaccination. You know, I keep on saying, the medical team keeps on saying that the advantage of being vaccinated far, far outweighs any side effect that you may suffer. So again, we're teaming up with the business community to see how we can best get incentives out there.
When you talk about loosening restrictions for fully vaccinated persons, how would that work?
Well, Marlene, certainly we're looking at, first of all, how people will be able to prove that they have been fully vaccinated, because I think that is the first question. You know, we always want to work on a good faith system, and we're always going to have the fullest of trust in our people. But at the same time, I think we need to be foolproof. And the only way we can do that is by having some type of vaccination ID. And so that is also an ongoing discussion we're having to see how best we can come up with that.
Yeah. And what type of incentives are you at this point considering?
I believe that some of the businesses are going to be offering prizes. Some are going to be doing some money donations to people who go in and get vaccinated, and of that nature, Marlene.
Yeah. So let's shift back to addressing the hesitation that people feel. Part of it is the side effects, and part of it is that people just are fearful of taking this vaccination. It's part of the education that has to happen. What is currently taking place to help to encourage, especially the high-risk populations, to get their vaccination?
You know, I can tell you, Marlene, that the age group 60 and above, which is among the most vulnerable, have rarely come out and gotten vaccinated. So I believe we have about 75% of that group. And that was one of the priority groups for us. But that being said, Marlene, the Ministry of Health and Wellness has embarked on a major education campaign, getting the facts out there about the vaccine, about the side effects of the vaccine, and about the benefits of the vaccine. Obviously, I think we need to do much more, and some of the strategies we are employing is actually going into the rural areas, have our health educators go out there, talk to them about the vaccine, and then come back into the villages a few days later after the education has taken place to offer the vaccines. And so that is going to be rolled out very shortly.
What seems to be the most convincing factor for the rest of the viewers who are watching right now who are still unsure?
The benefit of the vaccine absolutely saved lives, Marlene. I can tell you that for example, with the princess outbreak that we saw, the people who were vaccinated were asymptomatic. They had no kind of symptoms. And so I think what bears out is that the vaccine works. We have been saying the vaccine will not prevent you from getting the COVID, but what it will do is, one, it will, the side effects you're going to have if you contract COVID are not going to be severe. And we've seen that. And also the vaccine saves lives. It guarantees that you're not going to be dying from COVID. And I think that those benefits are incredible.
There's a very important lesson that came out of that particular outbreak, which was that if you've had your first dose, it kind of gives you a little bit of confidence, feeling like you're safer. But that's not necessarily the case. What's it been like so far in terms of people coming back for their second dose?
Well, it has been great so far, Marlene. Just to share some numbers with you, up to yesterday, we had 68,700 people with first doses, and of that number, 12,630 have received second doses. So the people who have been getting second doses, initially when we started, they were being given an 8-week window to come back, and then we went into the 12-week once the guidance changed. And so we're right up to where we need to be in terms of people getting second doses.
So currently we're giving out two vaccines. We're giving out the Sinopharm, the Chinese vaccine, and also
the Sinopharm, yes.
Sinopharm, thank you.
Yes.
And also the AstraZeneca. Yesterday we interviewed the Prime Minister. He indicated that there is an agreement to acquire the Johnson & Johnson vaccine. I think he said as many as 200,000. Can you give us an update on that?
Right. So we are working through the African platform, which we were dealing with through CARICOM to acquire the Johnson & Johnson vaccinations. We have made a down payment for 115,000 doses. We are expecting those to be in country, Marlene, by August of this year.
Okay. And we're paying for it, or it's a donation?
No, we are paying for it. We are paying for those.
Mm-hmm.
You know, we continue at the ministry, we continue to look for other vaccines, especially the ones that have received emergency use authorization from the World Health Organization. Yeah. That's our standard. And so as the World Health Organization recognizes more vaccines, we actively try to see how we can acquire them for our citizens.
At one point, we were also supposed to get the Russian vaccine, the Sputnik 5.
We were supposed to get that. However, that has not worn out, Marlene, and those discussions are also ongoing, but we do not yet have a date for the delivery of the Sputnik.
Okay. Another key component is, of course, looking at acquiring the Pfizer and Moderna vaccines, and these require specific equipment, yes, thank you, to allow for the storage. It's called cold storage or ultra cold storage. So what is the update in being able to ensure that we have the equipment necessary so if we get access to these vaccines, we can take advantage of it?
We are expecting to receive some in country, I believe, sometime around the 17th or 18th of this month, if I'm not mistaken. I hope I have those dates correct, but I can tell you that the month of June, we're expecting some of those freezers. And again, it is in line with the discussions we've been having to acquire the Pfizer vaccine and to target that 12 to 18-year-old population, Marlene.
Yeah. Now, as we await whether it is the Johnson & Johnson vaccine, as we try to encourage more people to get vaccinated, we just have to look at our partners at the region around us. Mexico, Guatemala, Jamaica, Trinidad, where they are battling an outbreak. How concerned are you that we may actually see a third wave that takes us back to what we saw earlier this year?
Of course, we are concerned. We keep monitoring what's happening in the neighboring countries, Marlene. And the best that we can do is, one, to make sure that our facilities are prepared to deal with it in the event it happens. Mm-hmm. Two, to continuously educate our people to try to have the message of the fact that this vaccine is spread through human interaction, for that message to sink in, to continue to encourage them to adhere to the public health measures, and trying to do the best we can in terms of those factors. I keep on saying that unless the people understand and unless our people cooperate with us and are willing to abide by the public health measures that have been implemented, this is going to be a difficult battle.
Yeah. What's our current positivity rate?
The current positivity rate, if you allow me 1 second, it is 2.23.
Okay.
And so we're still below that 5% mark. That is the world standard, no?
Yeah.
We're still below that.
Yeah. But it's moving up. At one point it was 1% or a little less.
It certainly is moving up. And it has been fluctuating back and forth depending if we're seeing spikes or not, yes?
Mm-hmm. Now, what's the plan for containment for these clusters that you've identified?
Well, they are in isolation, Marlene, and they're being monitored closely by the teams on the ground. Mm-hmm. And that has been one of the strategies that has worked tremendously for us. We've been able to quarantine the people who we have identified as being positive, and that has been successful for us.
Yeah. Minister Shabat, as you're aware, the medical community has voiced their objections in regards to the reopening of the borders for foreign visitors, specifically citing how Quintana Roo and Petén are in what those countries classify as red zones. They have an active outbreak. From your perspective, we've spoken with the Ministry of Tourism already about the protocols they have in place and border management. But from your perspective, how do you further this discussion with the medical community, being that some of the outspoken members are actually a part of your advisory body?
Yes, Marlene. This has been a challenge for us. Obviously, we convened that team for them to advise us on the best way forward. And when they speak, we listen to them very seriously, and we take very seriously what they say and the advice they give us. In this case, Marlene, I can tell you that we work very closely with the Ministry of Tourism and the Ministry of Immigration to make sure that we have as much safeguards in place as possible. And there is a balance that has to be struck. You know that for us, it has been equally important to reopen the economy. We have too many people unemployed in Belize. When the surveys were done and the projections were done, we did not feel that we would not be experiencing a flood of people coming in through our land borders. And so far, that projection has worked out. It has been a trickle. I can tell you that recently we modified the SI in relation to people coming into the country, and we required that they must present a vaccination card to prove that they're fully vaccinated and that they last received their second dose 2 weeks before arriving into the country. Mm-hmm. If you can't prove that, Marlene, then you are bound to do a test here in Belize before you're allowed to enter into the country. Another thing that we changed is we are now requiring anybody entering the country as a tourist to have a minimum stay of 3 days in the country. And what we're trying to do by that is to ensure that we don't have people just passing through the country, going from one point to the other point. Yeah. And we felt that those are important safeguards for us to be able to control anything that might arise from the land borders. And so far, Marlene, I think it is bearing out.
Yeah. Has the ministry explored other options, as we've seen in the region, like only allowing vaccinated travelers to enter the country?
Well, that is part of the discussion, Marlene. And as you know, our largest market continues to be the North American market. Mm-hmm. And our neighbors in the North seem to have been very successful in vaccinating quite a significant portion of their populations. And so what we're currently seeing, both at the airport, also at the airport, is we see tourists coming in who are fully vaccinated.
Yeah. Now, I think one of the things that you've said and the Prime Minister reiterated yesterday was that you have a commitment to follow the science and to listen to medical professionals. If we were to go on experience, when there were concerns about reopening of the casinos, concerns about reopening the schools, we are seeing exactly what people were concerned about. There was an outbreak in both types of institutions. How do you learn from these lessons moving forward when the medical community says this is not a safe venture for our country?
Yes, Marlene, we always try to follow the science as best as we can, but I think the considerations for the cabinet and for the government is a bigger perspective, and while we are very much concerned about the health of our people, we're also very much concerned with the economic situation in which we find our country. And so for us, when we sit as a cabinet, it is important for us to try to find a balance, that we can protect as best as we can the health of our people. At the same time, we start to reopen slowly by phases the different sectors of the economy, because I think the reality is, Marlene, that our people need to get back to work, our people need to eat, they need to pay their bills, they need to send their children to school. And so what we try to do at the Ministry of Health and Wellness is to try to implement as many measures as we can to make sure that when the government decides to reopen any of the sectors of our economy, that we have sufficient safeguards in there to try to narrow and to lessen any of the side effects that we may see. And I can tell you, I want to say this very clearly, at this point in time that the clusters that we have experienced have been controlled, and that is because of the work of the people of the Ministry of Health and Wellness, our doctors and nurses, our public health inspectors, our surveillance team. You know, we cannot be I cannot say how grateful we are to them for the work that they continuously do, and the successes we've seen in this country is because of them.
Yeah. Now, as you talk about this this cross-ministry effort that has to take place, whether it's Ministry of Immigration, Ministry of Tourism, definitely Ministry of the Home Affairs. So when we look at what is currently happening in the country, there are repeated reports of mass gatherings that are taking place, whether it is for a social function, sometimes it's funerals, sometimes it's multiple types of events that people may be having. What's the discussion taking place there? Even things like the vigilance at the border crossings, where we know people move without passing through any kind of immigration.
So again, Marlene, we constantly speak to the Minister of Home Affairs and to the Commissioner of Police. At the Ministry of Health and Wellness, we set up the protocols, we set up the regulations that we feel, our team feels is the best to implement. And then we leave the enforcement to the police. Obviously, I do agree that we have seen a lot of a slackening up of the enforcement of the measures, and I think people are to a large extent exhausted of being home on curfew, of not being to go out and socialize and gather and so forth. However, we cannot forget that this virus is real. This virus continues to be among us, and so we are continuously engaging the police. Over the weekend, I got videos of some places in the Orange Walk district that were having, some clubs are having parties disguised as restaurants. And these things are very worrisome to us. We continuously send these things to the Commissioner of Police, and we ask that these things, that the rules, the public health regulations be strictly enforced. As you know, Marlene, we moved away from a system where people were being summoned to come to court to a ticketing system. And so we are pushing the police to go back to the strict enforcement of these protocols.
Meaning that they take them into the to a holding cell?
No. That they make sure that these places that are supposed to be restaurants operate as restaurants with the capacity that has been designated by the Ministry of Health and Wellness, and not just disguised as a restaurant and then turns into a nightclub. To make sure that we don't have more than the allowed amount of gatherings, whether it's at funerals, weddings, or other parties, to enforce the regulations, Marlene, because as you correctly see, we have seen a wanton disregard for them recently. No?
Yeah. Is there a phased approach? You know, I keep on talking about what we see just right around us once again. When Mexico has the stoplight system, Guatemala has a similar one for each state. This amount of capacity in the hospital or hospitalizations, we move from green to yellow or orange, and then orange to red. And all of these have actions that the public can anticipate what will come. Are we at that point yet that if we see the hospitals, more hospitalizations increase, that there is a predictable pattern as to what will come next with regulations?
Right, Marlene. So we're trying to be guided by the standards set by the World Health Organization, and so our benchmark is really that 5% positivity. If we see that we're back up to the 5% positivity daily rate, and it is consistent over a period of time, then we will have to move back to some drastic measures. We are praying that that does not happen. But that 5% is really our benchmark.
Mm-hmm. Now, what's been the status update in checking in on COVID units across the country? We have seen where things have escalated to the point where people died in parking lots because the hospitals were so overwhelmed. Have we been preemptive, understanding that there's an increase in cases, that we do a check of the hospital systems to ensure that we don't encounter that type of situation again?
We're continuously doing that, Marlene, and I can tell you that that particular circumstance, which I think occurred at our National Referral Hospital, I can assure you that that will not be happening in the future. They have actually an incredible surge plan in place, and a lot of infrastructural work has been done at that particular institution. We have, through the Ministry of Health and Wellness, we have provided them with millions of dollars in equipment, and so that in the event that we have a third wave, I am confident that our National Referral Hospital will be able to deal with it. I mean, provided that we don't have incredible numbers, you know. I must warn that, as we all know, while we may have equipment, we don't have for large numbers. I think the bed capacity at the National Referral Hospital is maybe about 52 beds. And so while we have capacity, our capacity is very limited, and that goes throughout the country. We keep working with our Western Regional Hospital to make sure that their surge area is also 100% ready to go. As you know, Marlene, we made some recent adjustments to the oxygen infrastructure and the electrical infrastructure at our National Referral Hospital. And this is all to make sure that in the event we do have what we are dreading, which is a third wave, that we are prepared to deal with it.
Yeah. And things like securing sufficient oxygen, which we saw as a major issue in the Indian outbreak.
Well, oxygen is always a challenge. Oxygen is always a challenge, and here in Belize, you may know that has been the major component in treating people who have to be hospitalized because of COVID. And so oxygen will always be one of the areas that we're going to be looking at critically. For now, that need has abated, and hopefully it will remain that way. Yes.
Now, there is another issue in looking at, while you may have beds and you may have units, that it's also a human resource issue. Minister, I'm sure you know that the nursing shortage is of extreme concern for the medical community in Belize. More so now because I believe it was last year there was an increase in the cost of work permits. And so quite a number of our foreign nurses that we have working in country are choosing to find opportunities in other country, lessening the amount of nurses that we have working at this time. I do note that, as you had committed, there is a scholarship program opened for 50 new nurses to go to school, or 50 new students to go to school to become nurses. But in the meantime, we are going to be short in a time of already a shortage.
Yes, Marlene, that is of concern for us, and I can tell you that as a government and in communication with the Minister of Immigration, we are looking at the cost of the work permit for nurses, and some overtures have been made in that direction. But the shortage and the potential increase in shortage is of concern for us, and it is something that we continuously address. You know, we get some nurses through the Cuban Brigade. We're looking at Nicaragua to see if we can get some from there. We usually get some nurses out of Nigeria, and the largest amount of nurses come from the Philippines. And so we continue to look around to make sure that we don't have the significant shortfall that could arise because of that whole work permit issue, you know?
Yeah. So you're looking at exceptions for the work permit fee for maybe nurses?
I wouldn't say exception, but we're looking at somehow to reduce it to make it more accessible for them.
Yeah. Have you gotten an update as to how many nurses have left or intend on leaving?
I believe that we are going to be having about 25 to 30 nurses leaving from, particularly, I believe, from the Carl Huchner Hospital.
And what is the plan to be able to fill those slots?
We are looking at our, like I said, we're looking at Nicaragua. We're in conversations with Cuba and the recruiting agency in the Philippines. So we're looking at all of these places to see where we can recruit nurses from.
It's a tough spot. I mean, we are competing with the UK, US, Canada for benefit packages.
that has always been our challenge. I think even for many of our Belizean nurses, they find it more lucrative to go to these countries. And so that is a continuous challenge. That is not something that is new or is particular to now, Marlene. This is something we have been experiencing for years and years and years. And so the challenge for us here in Belize is one, to see how we can educate more of our people to become nurses, and two, to find the ways that we can compensate them to make it so that after they've completed their studies, that it is attractive for them to remain in service in Belize.
Okay. Now we have a question coming in from the viewer from one of our Facebook streams, and I want to get that into you if you'll allow me. Jake Martinez wants to know, can we get our vaccines before the due date?
So the requirement is, the learning is that you can get your vaccine anywhere between 8 to 12 weeks after you have gotten the first one. You're being encouraged to get it closer to the 12th week. It is believed from the science that we have and from the guidance we have that is when your immune system is highest, or that is when your body is able to produce much more immunity to the vaccination. I hope I'm getting those terms correct, because those are really medical terms and ideas, Marlene, but that is the science.
So if for example, I've been given a 12-week wait, I can do it between the 8 and 12 if it's better for me at this time.
Correct.
Okay. And do people have to use the online application system, or can they just show up at one of the clinics and get their vaccination?
Well, we encourage them to do the online because, as you know, Marlene, we try not to waste a vial, and so we monitor it very, very closely. Once a vial is open, we want to make sure that we have a minimum of 10 persons to be vaccinated. And so if you log on to the app and you make an appointment, it helps our healthcare people to organize themselves and to plan. And so we encourage everybody to use the application to make an appointment to get the vaccine.
Yeah. Now, looking at what you are currently seeing with vaccination rollouts, I think you said on average it's between 500 to 800 a day. Why not just open it up? Let those who are interested in getting the vaccine of adult age get the vaccination, and then we move closer towards herd immunity.
Yes, Marlene, we'd love to do that. However, our supplies of vaccines, as you know, we're getting them, what we're getting in Belize right now is through the COVAX facility. And so we have to plan in accordance to when we are going to get our shipments. We don't want to throw the doors open and invite everybody to come in, and then you have people knocking at the door and we don't have vaccines available. And so we've done it planned in a phased way to make sure that we have vaccines to cover the targeted population at the moment.
One of the fears that people have is about the side effects of vaccinations. I know there's an ongoing monitoring system. What type of side effects have you seen, and how often?
Yeah, a lot of persons report headaches, severe headaches. People are referring some level of fever that lasts anywhere from a few hours to a day. People talk about having chills and so on. But those are the major side effects that we're seeing, lasting anywhere from a couple hours to 24 hours, Marlene. We have not seen on a large scale anything major beyond those. Mm-hmm. Some people have, they get very, very thirsty or very sleepy, but we have not seen any major side effects as a consequence of being vaccinated.
Okay. Now, bringing it back to our current situation with the cluster in the south, and you said that there's the detection of a cluster in the north. The contact tracing, I believe, is ongoing. Do
Absolutely.
you imagine that we are going to see more clusters within the next few days based on these large groups of persons who tested positive?
I think we may see an increase in numbers associated with those clusters. It is very likely, Marlene. I can tell you that we have teams both in the south and in the north doing surveillance and contact tracing and testing. And so it is very likely that we are going to see some additional numbers arising out of both areas.
Will you be asking in Orange Walk, when we saw the last outbreak, we know that a lot of it was tied to interactions across the border. Are you also asking for more vigilance in that area?
Absolutely. You know, Marlene, again, that is especially in the South, believe it or not, that is one of the things we're very much concerned about, because as you know, our borders are very porous, and as much as we try to control them, it is virtually impossible to absolutely control them. And so again, we're depending on our people to be smart, to act wisely, to act in what is their best interest and in the interest of their loved ones and of this country. Because for every person who gets infected, you have the potential of infecting 7 other persons and so on. And so again, it goes back to an appeal to our people to act wisely and to act in the best interest of their health and the health of their loved ones.
And before we close, let's just look at the vaccination rollout and the percentage of the vulnerable populations. I know you usually have these numbers. You said teachers are at about 47%. Where are we with other frontliners and other vulnerable groups?
Unfortunately, I don't believe I have those numbers this morning. I need to get an update on them. My apologies, Marlene. I'm not on those numbers, but I promise I'm going to get them and I'm going to send them on to you. Maybe you can share them in your evening news. I apologize about that.
Okay. Well, any final words to our viewers this morning?
Yes, Marlene. First of all, again, thank you, and thank you for the opportunity. And again, my gratitude goes out to all of our frontline workers. The work that you all are doing is just incredible, and we are indebted to you. And again, I am appealing to our population, especially our teachers and our immigration workers who are at the front line, to please get out and get vaccinated. The vaccination saves lives. Please get vaccinated. All
right. Thank you very much. And you've gotten your second shot already?
I did get my second shot last week. And, you know, I'm here. So I am living proof that the vaccination will not kill you.
All right. And that means you are far more protected now. Thank you so much for joining us and for providing this update. And, of course, continue to stay safe.
Thank you very much. All the best to you all. Thank you so much.
And there you had it. That was the update on the COVID-19 situation in Belize from the Minister of Health and Wellness, Michelle Shabat. Clearly, there are a growing number of cases in the country at this time. Contact tracing is still ongoing, but we do encourage you. It doesn't matter if the cluster is in your specific community or region, that we continue to follow all the protocols that are asked of us, wash our hands, watch our distance, and wear our masks. We're going to go ahead and take a break. And when we come back, we'll be shifting gears to talk to Galen University about a brand new master's program that they're rolling out. So please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service. Working off-site doesn't mean you have to be off your game. Studies have shown that simply adding a keyboard and mouse to your laptop increases productivity by 26%. Add a monitor, and you'll be 35% more productive. At Fulltech Systems, we have what you need to enhance your remote work or e-learning experience. With devices such as headsets, video conferencing monitors, webcams, keyboards, mice, docking stations, all with the brands you trust. Keep connected with collaboration tools like Microsoft 365 Suite and Kaspersky and perform efficiently no matter where you are. Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.
As one of the largest cable and internet providers in Belize, CBC strives to provide our customers with the highest standards of quality, value, and service in all aspects of cable TV and internet. Monitoring our systems closely, our technicians combine creative planning and state-of-the-art technology with years of experience and training to develop and provide the most reliable and advanced cable and internet service to exceed your expectations. For CBC and our team of talented engineers, technicians, and customer service representatives, delivering less than the very best is never an option.
Smart continues to expand its internet coverage countrywide to help you live a smarter life.
Our villagers are very happy. They are pleased to know that Smart went the extra mile to put a tower in our village so that our villagers can get live stream on their TVs and they can get their kids doing their online classes. I want to say to Smart, thank you for making it possible for us to get internet in Gardenia Village. We really do appreciate it.
Smart continues to take the internet and mobile services to communities across Belize. Now save even more when you bundle your Smart broadband with Smart mobile services. Smart, bringing people together.
stop running around the house.
Right now, Dad.
Damn it, Brian! I told you stop it! Can't you hear me? Are you deaf? Or you just being Time out. Your life is stressful, and it is easy to lose your patience. When you feel this is about to happen, take a time out. Harsh words are verbal violence and can be very harmful. They are not forgotten. Offering alternatives and communicating with your child is the best way to build real respect. I'm sorry, Brian. That just had a rough day at work. Can you do something quiet?
Do you want a job?
That's more like it.
And we're back, and we're moving into our second conversation for today. And as promised, we're finding out the latest as to what's happening at Galen University. They are rolling out a new master's program in development studies. And here to tell us more about it, we have the Dean of the Faculty of Arts, Science, and Technology, Sherry Gibbs, and we have the organizer of the master's program, Dr. Filiberto Pinedos. Good morning and welcome.
Good morning. Morning. Thanks so much, Marlene. Good
Well,
morning, everybody.
Thank you for joining us to tell us about this exciting news. So let's just get a bit of a background as to how things have been going at Galen University. We know that some schools are moving back to in-person classes. What's the status at Galen?
Yeah, this summer semester is still online. But we, fingers crossed that we'll be able to have things opened up and classes resume on campus in September. We have to follow the regulations laid out by the Ministry of Health. And so ensuring that we have the spacing in our classrooms. And so we're dealing with that right now and assessing things and hoping that we'll be able to invite all of the students who are ready to come back to campus. I know there are quite a few. Of course, we do have a number of online programs. And so for those students, they haven't missed a beat and it's been pretty easy for them. But for those who are usual, are face-to-face and look forward to coming to campus, it's been rough on them. So we're hoping we'll see them soon.
Yeah, absolutely. I think clearly there's the opportunity here is in being able to have more people access. But for those who do prefer face-to-face, it's been a challenge.
Yeah, it has. And they're trying. One of the things that we did from really early on, which I think has helped us a lot, is every semester students usually have to take at least one online course. And there's a number of reasons for that. Some of it is because of our faculty and having to work around their schedules. But students have been familiar with the online platforms that we have and what it's like to take an online course. And the same for our faculty. I think maybe 99% of our faculty have all taught at least one online course. So when we had to make that transition into online, it wasn't that difficult for us. We already had the platforms and everything set up. It was just that the students were then, sitting at home. I think for the first little bit, it was sort of that novelty, they could hang out in bed and not have to get dressed. But yeah, now I think they're finished with that. They want to come back and see their friends.
Of course. And so for the next semester, what's enrollment looking like? We know that times are tough economically.
Yeah. And so enrollment, we're seeing a lot of applications coming in, which has been great. Nice. We acknowledge and recognize the economic issues right now. And so we've done a reduction in our tuition rates. Okay. So there's a 20% reduction to assist those that, everybody, but it's really to acknowledge what's been going on and that people need a little bit more assistance when trying to access higher ed.
Now let's move into the new baby of your bunch, of your program bunch, that is. Over the years, we've seen Galen move into rolling out some new master's programs here in the country. I think you were the first to do the MBA program, and since then you've been expanding in your graduate programs. Let's talk about this latest introduction and why you felt it was something necessary for professionals.
Yeah, we're really excited about this, and it's something that Dr. Panados and I have been, and some other colleagues have been working on and discussing for maybe about 5 years now. So it is a long time coming. People out there heard, sort of rumors. They heard that something like this was in the works, and so we got a lot of interest coming in. So we know it's there, but we were finally able to, last September, really start focusing on developing this and going through all of the steps that are required. We have a quality assurance director now at the university that guides us through developing new programs, as well as assessing and reviewing our current programs. And so that was really important for us to go through and to develop this and make sure that what we're doing with this program is to meet the needs of the country. I want to ask Filiberto he'll be able to discuss a lot more of this, being the new coordinator for the program.
Yeah.
Sure. Well, thank you, Sherry and Melanie. Well, I'm excited too about this program, and as Sherry mentioned, it's something that has been in the making for quite some time. Yeah. I have been working in the development field, if you want, at various levels, both in research and kind of in practice at the grassroots level. Yeah. And I think like many of us, or many Belizeans, realize that we're living in a context where we're facing, both at the national level as well as the international levels, some major challenges. Climate change certainly is one of the biggest ones. That is threatening the very existence of life on the planet, and we need to do things differently to mitigate against that, and also kind of find ways of adapting to that reality. So tremendous environmental challenges. I mean, I think the pandemic that we have seen is partly connected to that. Of course, greater interaction between human beings and wildlife. The quick movement of the virus across the globe is because of travel. So a lot of things. So anyway, there's lots of environmental challenges, and I think the same thing in Belize. Farmers will tell you, it's very difficult to predict the weather. It's hard to produce. We're facing tremendous economic challenges, and I think again, COVID has kind of shown a light on that. That there are tremendous economic challenges, and we cannot do business as usual. And social challenges. Again, I mean, I think the people who are most affected by the pandemic are those who are marginal, those who are already poor, and so on. So all of that to say that Belize, as most countries, are facing tremendous challenges in terms of thinking about and crafting a future, and or engaging in development, if you want. Yeah. And so that has been something we've been thinking about a lot as educators. We're very concerned about that, and our role is to prepare people who can engage with those realities and generate solutions. So that's why we're really excited about it. I mean, imagine.
I'm glad you moved in that direction, because let's just take a moment and step back and think of students who maybe just attained their bachelor's or professionals. What would you say is the benefit of getting a master's in development studies? What does one learn, and what will they be able to do or contribute?
Sure. I mean, this master's program is designed with Belize and with the region in mind. Mm-hmm. The question of development is one that it's complex. And so I think anybody who, I would say students who are interested in making a difference, in understanding the social, the economic, the political, and the environmental reality of Belize, and being part of the change, being able to have an interpretive framework for understanding what's going on, and also for imagining what a future for Belize might be, and the skills to engage in that. And that might be both in terms of research, generating kind of the kind of knowledge that would help us understand what's going on and consider options. But also in terms of policy, which is focused much more on problem solving, or community engagement, and engaging with communities and responding to the needs, the challenges that they're facing, or even in business. I mean, there's a lot of things that are happening in terms of like what is referred to as social entrepreneurship, where you can have from a business platform to make a positive contribution in society. I like to quote Michael Rosberg, who's a friend of mine, who said, it should be possible to do well by doing good, which I think is kind of the idea of social enterprise. Yeah. So if you really want to make a difference, this would be a great program for you. It will help you to understand the whole concept of development, what are the options, and understand it from Belize, from the region, because it does have a very Caribbean and Latin American flavor.
Yeah, and that was my next question. So where you can access this program in other parts of the world, if I am intending, for example, to work in Belize, is it an added benefit to learn in this particular context?
Absolutely. Absolutely. I mean, the Caribbean, Latin America have been at the center of development, if you want. If you think about the history of the Caribbean, the emergence of the whole global system. The Caribbean and Latin America were very, very influential, very critical, not necessarily influential, but obviously very critical to that. And so there are lots of ideas that have been generated, both in terms to critique the global system, but also to imagine alternatives. And working from a place like Belize, where you are starting from the grassroots, it's not about simply taking theories that have been developed elsewhere that you apply in this context. Of course, I'm always open to all of those ideas, and I'll always be a part of it. But I think doing a program right here in Belize that draws from the learning also of communities, I think would give you a key advantage. I mean, we have lots of students. I'm involved in another part of my life in study abroad, which is students from North America, Canada, the US, who come to Belize to think about some of these challenges that we're talking about. And why do they come to Belize? Because it offers them this unique platform, for thinking about these challenges. And so I think you would have additional value. Yes, you could go elsewhere to do a program like this, but you won't have that possibility of interacting kind of on a regular basis with the starting from the grassroots.
Yeah. Definitely. I mean, we have no shortage of areas that can be researched. Is that also something that you look forward to, having students working on assessing the challenges we have in any one of the development areas, whether it's looking at the economy, poverty, gender issues? I know you went in detail with sustainable development. Is that also an opportunity that we're seeing here with the rollout of Galen's new Masters in Science program?
Absolutely. I mean, the whole mission of the program is both to generate knowledge and leaders in development. And the program is designed such that it balances theory and practice. So, students will get to deal with development theory, which is obviously necessary, but then can look at Latin American thought around development, Latin American Caribbean thought, and practice around development. And the neat thing about this program is that introduces students to the field of policy studies, and the field of research and community engagement, and social and entrepreneurship. And so students will have an opportunity to do what we call a capstone project, which is kind of at the end of the theory, if you want.
Yes.
They get to do a sizable project. And the idea is to do research, right? Engage in a research project that will help to inform or solve a problem, or do a policy analysis, take a policy issue, research it, look at options that could inform policy making, or at least inform dialogue around questions of policy, or work with local agencies or businesses, local communities to generate kind of a development project, if you want, to bring about change. So it is definitely connected to that. The idea is that it will produce both knowledge and practice that will tackle problems right here in Belize.
Yeah.
And I think if I could just jump in, I think by offering students those choices, you have those who might be coming into this program already working on the ground, maybe in any of the various local, regional, or international NGOs, maybe those working within government, who are interested in getting more experience, or they need help with regards to policy monitoring or review or assessment, developing new policies, or those who are working with communities already. And so it's targeting those individuals as well as those recent graduates who are interested in this area and want to be able to get in there, figure it out, and help them understand maybe what area they want to get into with regards to development. And so I think it's one of those perfect programs for anybody, whether they've got experience in working with organizations already, or they've just recently graduated and are ready to jump in and do some work.
You said that this idea had been floating around for a while. What made you think that this was the right fit for Belize?
I'm not sure whether the right fit for Belize. I think we've spoken quite a bit about that. I mean, of course, it's been in the pipeline. We've been working at it slowly. It takes some time to develop a program. Now, it is interesting that it's kind of has coincided with this global pandemic, where there's a interest in rethinking what we have, rethinking reality and trying to figure out, okay, where do we go from here? So the timing is perfect, I think. I don't think we didn't plan the pandemic, obviously, but I think it comes at the right timing, because it's forcing us to think about, how do we organize our economies? How do we organize our society? Even in terms of questions of governance in Belize, there's a lot of questions about that. So the timing is quite right. I don't think, I said, we didn't plan it to work in that way. We're just, in a way, I think it's fortuitous that it has. Yeah. So I don't know what that was your question, but that certainly is what came to mind.
Well, I hope you didn't plan the pandemic, but the pandemic, as I think, Sherry, perhaps we've had conversations along these lines, that there are going to be lessons that we're going to take away from this, and a big part of it is kind of this magnifying glass of inequities that exist. What is the opportunity of enrolling in a program in a time like we're in right now?
Well, I can think of two things. I mean, one of them, obviously, you're getting a new skill set, right? That as things open up and things move in different directions, you'll be positioned for doing that. So at a personal level, I think there is a lot of great things for you to enroll in a program like this. But the other one is that I think is related to what I just said, is that I think there's an openness to try different things. So which is an opportunity then to actually bring about change. But maybe there's a third thing, and there's like a lot of things that people are doing things, and I think the pandemic has sort of stimulated people's creativity. They've responded to the difficult circumstances by starting to do different things, whether it is, I'm going to start to do farming, or I'm going to start a new business, or I need to work with my community, or we need to improve governance. So there's all of that. So the number of acts are generating ideas and engaging in different kinds of action. So it's also a great opportunity, for thinking about this issue. So to me, the timing is absolutely right.
And Sherry, let's get into some of the details here. How does one qualify for the program, and when's the start date?
We're looking at an intake starting for our new school year 21-22, so September is when we'll start. We're accepting applications already. And so we're looking at people who've got a bachelor's degree. Social science background would be really helpful. So anthropology, sociology, criminal justice, even environmental studies or environmental science, natural resource management. But also people coming in from the business field, I think, would also do well in this program. They might need a little bit of catching up when it comes to maybe social science theory or social theory, that sort of thing. But those are the individuals that we're looking at. And whether you're a recent graduate, I know we've had a number of our graduates within the last 2, 3, 4 years who wanted to go on to grad school, don't want to leave home and are looking for something more close and maybe more specific, something more focused on Belize and what they can do here. And so this would be perfect for them. as well, like I had mentioned, those working within various organizations, various ministries, even if you're, maybe a business owner as well, like Filiberto was mentioning, and interested in this concept of social entrepreneurship, and what you can do to help develop your community. So I think we intentionally left it like this to make it broad so that we can cater to a number of individuals. They'll be coming in with their, I think, these backgrounds. So if you're coming in from an anthropology background, you've got that. You probably will have an idea of an area that you want to get into. And during the courses, you'll be able to focus in. There'll be an additional, before they do their capstone project, we'll have a capstone design seminar to work with students to really help them narrow down. So whether it's a research hypothesis, whether it's identifying maybe that area of policy that they want to get into, or community engagement, what sort of communities do they want to work with? And so we're going to be there to help them and work with them every step of the way.
Nice. And let's talk about the affordability.
Yeah, so we want to make this accessible for anyone and everyone. Our finance department has been working really hard on developing various options for people. We have our loan program. Like I said earlier, we have a 20% reduction rate on all of our tuitions for the graduate, for the undergraduate, except for education, which already have a sizable reduction rate.
Yeah.
And so that's there. And so for this program, yes, definitely. And of course, if students are able to pay up front, they get an additional 10% off. And then the loan program that we have, as well as payment options. And so, it's important for us making education accessible, and especially with this program. That was one of the things that was, when we were going through, this sort of a SWOT analysis and the threats and opportunities of this program, COVID presented a lot of great opportunities. Yeah. But then, of course, the flip side of that is the, those who would be able to afford coming into this program because of the hit to the economy, and those who lost their jobs or had to take a salary reduction. And so we're really cognizant of those individuals out there who may be struggling with that. And so, like I said, our finance team is there willing to work with people. So I just encourage anyone, just send in your application, come in and talk to us, and see how we can get you through this program.
And what's been the interest level so far?
Yeah, we've been receiving some emails when our flyers hit social media last week. We started to get some emails coming in, which has been really great. We'll do some more targeted campaigns, and even the individuals previously who had been reaching out to us, will be letting them know that we've got a good solid program that we've been working on quite a bit, and that we're ready for them.
And what's the schedule like for the program? Would working professionals be able to manage both jobs and being able to pursue their studies? Or is it for people who are continuing after their first degree?
Yeah, so we were looking at it being a full-time, and this is a discussion that we've had of late, but the first 2 semesters would be 3 courses that they would take, and then after that it would be reduced to 2 courses. Okay. We're looking at 5 semesters, 12 courses, 37 credit hours. That's the total. We do have a part-time option, which of course would extend your time a little bit more. But, again, helping you, whether it's, for financial reasons or just you're working, and you need a little bit of that extra time to be able to get through it.
And Dr. Pinedos, of course, as the coordinator for the program, tell us a bit about the rest of the team that will be working with these students.
Right. So the idea is to, of course, draw on existing Galen faculty, but also to draw from outside of the Galen faculty to practitioners, people on the ground, and as well as to colleagues and partners from outside of Belize who are engaged in this kind of work. So we have already identified some people. I won't go into detail, but we have identified people who are working in kind of leading leaders in these fields in Belize, whether it's kind of the environmental studies part of it, environmental policy, we certainly have people who have engaged both in theory and practice, and that I think is particularly exciting. We have been talking to colleagues who teach in other universities who are also going to be, contributing to the program, either by teaching a course or being guest lecturers in the program. So we are putting together a team that's going to be quite diverse and that will bring to the program, some cutting edge knowledge and as well as practice.
Yeah. All right. So people can start enrolling as of now.
Yep. Send in your application. Go to our website, check us out on social media, give us a call, send me an email, and we can set up and we can have these kind of meetings, virtual meetings. Come into Central Farm if you want, and we'd like to discuss all of this more with you. But yeah, reach out. The Galen website, galen.edu.bz. I'll save going through email addresses so they don't get lost. But I think it's pretty easy to find us, to give us a call, send us an email.
Okay. Yeah. And as you said, the first program starts this September. So is there a deadline for submission?
Well, we'd really like to get applications in by about the first week or so of July. But of course, we recognize too that it takes some people a little bit of time to make. It's a big decision, right? You may not have been thinking about this, and then you hear about it and say, yeah, okay, I want to do it. Might take a little bit of time to get things together for you to do this. So we're encouraging you to get your applications in as soon as you can.
So it's flexible. That's what you should say, yeah? People can call and find out more.
Yeah.
All right. Well, we appreciate you telling us all about it, and definitely a great opportunity for people to take advantage of. So best of luck.
Thanks so much, Marlene. We really appreciate it.
All right. Great to see you guys, and continue to stay safe.
Thanks, you too.
All right. And with that, we're going to go ahead and take a break. And when we come back, we'll be talking about 2 more Belizeans who've been able to access athletic scholarships. We'll tell you more in a few, so stay tuned.
Good morning, sweetie. It's time for school.
Are you a teacher or public sector employee who is thinking of owning your new home? Get the keys to your new home with Belize Bank's all-inclusive mortgage, the best financing option in Belize for your new home purchase or construction. Inclusive of all mortgage-related fees, no down payment, affordable terms, amazingly low interest rates. Visit our nearest branch to speak to one of our financial advisors to discuss how you can be one step closer to owning your new home. Some conditions apply.
"2020 taught us the importance of being connected to the virtual world, and NextGen is here to keep its commitment to you. Even if you're physically apart, NextGen keeps you digitally connected."
Okay everyone, thank you for following me today.
NextGen provides more than just an internet plan. They provide service plans that support all your online needs. Sign up today and get your NextGen's ultra high-speed internet service. NextGen, powered by Central TV and Internet.
Wow. Oh my God, she drunk. No hurry, I got this.
Goodness.
Oh my gosh, it's the Alice.
Being the hardest. The hardest. But you had way more than 2 drinks tonight, love, which is a legal limit to drive. What about you? Can you drive?
Well, I was drinking soft drink all night, so I can drive her home.
Thanks, Bree. Of course, Tricia. You know I got you. You're my girl.
That's what I like to see. Friends don't let friends drive drunk. Because you can't replay in a real life. Stig says so. Can't replay in a real life.
Brianna, what do you want to be when you grow up?
Mommy, when I grow up, I want to be a doctor.
That's great, honey. You have to study hard then and get good grades.
Yes, Mommy, I will. Mommy, why do the neighbors have to play the music so loud?
Every day, people are affected by noise. Noise, like loud music, is not a concern for those making the noise because they are not the ones being affected. It is usually the vulnerable that is impacted the most by noise pollution, such as the sick, the elderly, and the young. That is why the Department of the Environment is asking you to be considerate of your neighbors. Be mindful that your actions can have lasting effects, and know that noise pollution is an offense under the pollution regulation.
When someone you love becomes a memory, the memory becomes a treasure. Channel 5 introduces the Daily Obituaries. The Daily Obituaries will broadcast all death and funeral announcements and memorials to honor your loved one's life and memories. The Daily Obituaries airs on Channel 5 prior to the evening newscast, with subsequent repeats at 10 p.m. and 12 noon the following day. It will also be placed online on our social media platforms, all for a standard package fee. Celebrate their lives and memories with Channel 5's Daily Obituaries. Honor in life and reverence in death.
And we're back, and we're moving into our final conversation for today. As we told you, we're finding out more about 2 recent scholarship recipients of athletic scholarships, that is, about this opportunity, how they got it, how they're going to take advantage of it. We have with us to tell us more Fatima Ramirez, who is one of the athletic scholarship recipients. We have Gareth Bruce, who is the other scholarship recipient. We have Brighton Codd, who's a member of BK Sports, and Dante Jeffrey, who is the coach. Good morning and welcome.
Good morning, Marlene.
Good morning.
Thank you for having us this morning.
Uh-oh, we lost one? Did we lose someone there? Okay, but we're going to keep the conversation going. And I guess, Brighton, you can set the tone for us. Of course, here in your capacity as BK Sports, this is an organization that was started to help athletes get access to scholarships. Tell us a bit about how it's been going so far.
It's been going great, Marlene. Actually, we started in 2018, and we've come a very long way in just a short time. To date, we have secured, or at least been able to speak on behalf of 15 athletes and secure at least 10 scholarships for our athletes in Belize. And We're starting to see the demand go up for other sports as well, so basketball, track and field. And we primarily started out with volleyball because that's the sport I played, and so I wanted to create a mechanism that would be able to assist volleyball athletes to further their educational studies as well as advance their athleticism within the sport that they play. And well, we're here today because we're actually celebrating the achievement of Gareth and Fatima, who receive scholarships, full scholarships to Eastern Wyoming College. And I'm glad we have the coach here today to give you all the details about the scholarship, but it's really an exciting time for us. This is definitely one of the better scholarships we've been able to secure for our athletes here in Belize, and we're looking forward to see exactly how they go about with their journey from now.
And we still have Fatima and Gareth with us. So tell us about what this opportunity represents for you.
Excuse me, what the opportunity represents for me?
Yeah.
Well, I've been playing volleyball for a very long time, so I'm very excited. And I'm happy to represent my country and my family.
Fatima, you know, very often athletes play for the love of the sports, and we know that especially in Belize, where we have people who are dedicated to the discipline of their sport, they're not necessarily aware of the fact that there may be opportunities like this that come up. Did you have any inclination that this would be where volleyball would take you?
Yes, for sure. From my start, I've always dreamt of playing abroad, so I made sure that I worked hard to reach this achievement.
Yeah. Okay. So do we have Gareth with us still? I think we lost Gareth. All right. Well, let's hear from Dante. Dante, tell us about this type of recruitment and what you're looking for.
Yeah, of course. So, you know, there's a saying that good things come to those who wait, and I think this is a really good example of that. I was lucky enough to be able to start talking with both Fatima and Gareth about 18 months ago in February of 2020, and we were working on possibly bringing them over last fall for a variety of reasons that didn't work out, and it's probably better that it didn't, considering everything that happened with COVID. But so we've just been talking with them for a very long time. Very happy to work with both Brighton and his brother Beresford, who helped a lot in this process. And we are just absolutely thrilled to be able to give them this opportunity and have them come and experience something new, start their college journey, and be very, very successful here and wherever they go after.
Now, it's not uncommon for talent scouts to be looking for athletes from other parts of the country or other parts of the world. How did you stumble upon the Belizean talent?
So it's kind of who you know. I got lucky. I have another coaching friend who I believe came across Gareth's video somehow, and he, didn't have a scholarship or an opportunity for her, but he suggested that I take a look, and I believe I started talking with Gareth first, and not long after that, I was introduced to Fatima. But you're correct. It's not unusual to scout internationally for us. I mean, we have many players from Europe. We get players from South America, as well as all over the United States. So it's a very diverse, multicultural team, which is one of the things that makes me most excited and grateful for this job.
Now, Dante, of course, as a college level coach, when you first saw the level of talent that we had, what was your impression? I mean, Belize wasn't on your radar at that moment.
It wasn't at the time, but it will be going forward, absolutely. I think the fact that Belize maybe hasn't been recruited as much yet means that it's ripe with a lot of talent, a lot of eager, hardworking players that can definitely come over here and make an impact at the college level in the United States. And so I think it's an untapped market, if you will, and I hope to keep this connection with Belizean volleyball for a long time coming.
Yeah. Now, what does this scholarship include?
So the typical, what you hear as referred to as a full ride scholarship, that's essentially all of the school costs, all their classes, their dorm room, their meals, their books. Everything that the school would charge a student is being taken care of because they're both, great volleyball players that have worked a very long time to earn this opportunity.
Yeah. And keeping up with academics as well as performing athletically.
Absolutely. I mean, academics is obviously a huge part of it. We always want to make sure we're taking care of business in the classroom, not only to stay eligible for volleyball, but because, a very small percentage of volleyball players end up playing professionally. So we want to make sure the education is the priority. So no matter what they do, whether it includes volleyball or not, they are going to be successful for a very, very, very long time after they graduate college.
Yeah. It takes a tremendous amount of discipline, doesn't it?
Absolutely. And that's, something that really drew me to both Gareth and Fatima. The fact that they've played with the national team program in Belize means they have that discipline, they have that work ethic, they've received, the highest training and have played against great competition. And so that makes me very optimistic about what they can bring and prove over in America.
Yeah. And Fatima, tell us a bit about the expectations that you have playing at this level.
Well, I definitely expect to reach at a much higher level than I am now. I expect to grow as a player while receiving my education.
Do we have Gareth with us now? Oh, she's still not joining us. Now, Fatima.
Yeah, she's in.
She's in?
Yeah, she's in.
So, but first let me go to Fatima while we get that queued up. Tell me what it was like when the approach was first made. I mean, you've been playing volleyball for so long. You said you had your sights on an athletic scholarship. Tell me what it was like when it finally started to pan out.
Well, it started to get really exciting because all my dreams are falling into place. And I've been playing for so long, so I finally reached where I want to be. I'm finally where I want to be now.
Yeah.
In terms of being abroad, playing abroad while receiving my education.
And I imagine you see this as a stepping stone.
Yes, for sure.
For what next?
I'm not sure.
All right, so we do have Gareth with us now. Gareth, it's time for you to play catch up and tell us about what it felt like for you. Coach Dante has already shared with us that your performance was what caught the attention or what let people start looking into Belize. Tell us a bit about what it was like for you as this whole process started to unfold.
For me, it was very exciting and shocking at one point because many coaches see me as a small athlete in height, so they weren't much focused on getting me over there to pursue a career and giving me the opportunity to have an athletic scholarship. So for this, it was really exciting.
And Gareth, all the years you've been playing volleyball, was this also your goal, what you were working towards?
Yes, since I was in primary school and high school, I always wanted to further my studies in the U.S. after high school. And I'm finally here. I'm grateful and excited for this opportunity.
Did you think that volleyball was what was going to get you there?
Yes.
All right. This is so great to hear, especially from young female athletes, that you are seeing the opportunities that come with investing in your sports. Both of you, as players on the national team, I know you work very closely with the younger girls as well. Do you think that things have changed now that they see investing in sport as an investment in themselves and even their education for the future? Fatima?
I think the younger girls see us as a role model. So they're seeing that we've gotten this scholarship and we're furthering our education and how we play to a higher level. So they see that and it pushes them to work harder so they can also reach that goal of playing abroad and going to the US.
Okay. And Coach, tell us a bit about the training program that they're going into at Wyoming College.
Absolutely, yeah. Like I said, one of the very exciting things about these two athletes is that they are no strangers to working hard in high level, high intensity practices and conditioning. And they can expect the same here at Eastern Wyoming. The first 2 to 3 weeks that they're on campus, it's before school even starts. We're the only people here because we get here early to make sure we're putting in the work to get ready for our season, which starts in late August. And so I remember Gareth told me a few weeks ago she's not a morning person. She doesn't like those early morning practices, but I think she's going to get used to it and do really well here. But they're going to be ready, and that's one of the really exciting things. And they're going to have an environment that's, I think, supportive and fun, but also challenging. And I think that's what high-level athletes like them thrive on, and that's what they deserve.
All right. Girls, what are you going to be studying?
Well, I'm going to be studying criminal justice.
Nice.
I'm going to study accounting.
All right. Looking forward to balancing both?
Yes, for sure.
Well, you know, the funny part is, Coach, don't you worry. We have seen them in action, so we know the power that they have. And Garrett, you already said you're not much of a morning person, right?
Yeah.
Yeah. But I do want us to take the opportunity. You know, when we look at the amount of talent we have in this country, not just in volleyball, but in many other areas, what would you say to them about putting in the work in their craft? You guys we've seen you play, but it didn't come overnight, and you have spent an enormous amount of time training over the years. Tell us how you share that message on to the younger people, the younger players, and even people who are watching today. We'll start with you this time, Gareth.
I would say that they should work hard, work tremendously with coaches and staff that they have. I think they should never give up on their dreams, no matter what people or others may say.
Okay. And Fatima?
I would say always work hard, even though there'll be days you don't want to train or don't want to get out of bed. You still have to be strong-minded, and always be open to corrections and always be open-minded. Yeah. There's always something better. I'm sorry. You can always be better than you are now.
Yeah. And Coach, I guess a good lesson here is to, you know, never underestimate the value of promoting yourself. You said there was a clip that was circulating that kind of led to this discovery.
Yes, I believe maybe it was from, you know, her agency, yes, or her recruiters that were getting her video out there, and it certainly caught the eye. Garrett's video caught the eye of some coaches, and I'm very grateful that one of those coaches was a good friend of mine who passed it along to me. And I think, you know, Gareth is going to be someone who in just a few months is going to be turning a lot of heads in our conference, and is probably going to be one of the more fun, exciting players to watch. So it's going to be fun to see it in person, that's for sure.
And these are your first two Belizean students?
They will be, yes. Yes, brand new, so I got my flag ready.
Even better. That means you guys can escape the cold from Wyoming here. And girls, you know, you're going to have some time to adjust to that winter. Brighton, what's the advice that you give these young student athletes about balancing college life and athletics?
Wow, time management is super important. It's one of the things that I learned in polarity management is two priorities. You have your education and you have athletics, and you have to know how to balance both of them. And it's going to be critically important that you adjust very, very fast to not just the weather, but also the new culture that you're going to be immersing into. That way you are able to build your resiliency as an athlete, as well as further your growth and development within your sport, as well as your education. So just stay the course, be determined, always ensure that you're working towards your goal, set small goals and work towards your bigger goals, and always remain coachable. That's one of the things I always tell athletes, remain coachable, because there's always something new that you could learn in terms of philosophy from a new coach. So something that you're gonna be learning in Wyoming is it's different from something that you've learned in Belize. So always be open to learning and growing as an athlete.
Well, ladies, Fatima, Gareth, we wish you the best of luck. We know that you are going to represent us well. You're going off to further your studies, but of course, you know, anytime you leave Belize, you're an ambassador for us as well. And Coach, our next conversation, you'll be able to talk Creole with us.
Absolutely, I look forward to it.
All right. Best of luck to all of you, and thank you for letting us hear about your journey.
Thank you.
All right. And with that, we're going to go ahead and take our final break, and when we come back, we'll have our wrap-up, so stay tuned.
Hola, Tony.
Hey, Kevin, ¿qué onda? ¿Qué pasa?
Nada, le vine a buscar porque necesito comprar más mercancías de vasos y platos desechables para mi tienda de comestible. Me estoy quedando sin esas cosas.
No, hombre, fíjate que desde el 15 de abril no puedo importar nada de eso. Y se me acaba de terminar todo lo que tenía hace como 3 semanas.
Oye, pero nunca has estado sin esas cosas. ¿Qué está pasando?
Mira esto. Esta es la nueva ley que prohíbe todo el uso de plásticos no reutilizables. Esos son vasos, platos, cucharas, tenedores, todo eso. Desde 15 de abril de este año no he podido importar nada de eso. A partir del 15 de enero del 2021 nadie puede fabricarlo. 15 de abril 2021 nadie lo puede vender. Y a partir del 14 de julio del 2021 si alguien te agarra con eso, te multan.
Híjole, no sabía eso. Necesito cambiar algunas cosas. Les diré a mis clientes por qué esas cosas ya no están disponibles. Gracias, Antonio.
Así es, cuídate, man.
Good morning, sweetie. It's time for school.
Are you a teacher or public sector employee who is thinking of owning your new home? Get the keys to your new home with Belize Bank's all-inclusive mortgage, the best financing option in Belize for your new home purchase or construction. Inclusive of all mortgage-related fees, no down payment, affordable terms, amazingly low interest rates. Visit our nearest branch to speak to one of our financial advisors to discuss how you can be one step closer to owning your new home. Some conditions apply.
It's a fact that with Smart, you get truly unlimited everything. Only with Smart, you get unlimited data anytime. While with the other guy, it's only double data on weekends. With unlimited data every day with Smart, there's no need to wait. So, it's a fact that our unlimited plans beat the competition. Stop being measured and told when to use your data and get unlimited talk, text, and data. Experience the true unlimited plans with Smart. That's a fact. Make the switch and live smart.
Back. And I want to say thank you for tuning in this morning. We had 3 excellent conversations. Of course, starting off with putting the situation of COVID into perspective. At this time, we do know that there is a cluster that has been identified in the south. There is the expectation that there will be more cases detected in the north. And at this time, the ongoing contact tracing is taking place. We'll probably see more cases being detected as the next few days unfold. Currently, We have about 120 active cases, and those are cases that have been detected so far. It is really important that all of us remember that we are still living in a pandemic, and no matter how exhausted we all are of distancing ourselves or wearing our masks or staying away from others, we must remain vigilant. We do not have sufficient people vaccinated in our country as yet to abandon all of these protocols. And so in the meantime, we have to keep on doing all the things we've been asked to do for over the past year. Wash your hands, watch your distance, and wear your mask. Keep on protecting yourself, and of course, that by extension helps you to protect your loved ones. It's a great time to remind people as well that if you are feeling sick, if you have any of the symptoms that we now know may be associated with COVID, don't go to work, don't go to school, and just do a check-in to ensure that maybe you haven't been exposed, or if you need to get tested to ensure that you're not positive and potentially spreading the virus even more. We also want to say thank you to Galen University for telling us all about their brand new master's program. They're offering a master's in development studies, and the new intake will get started this September. So if you're interested, you can get in touch with Galen. There are some reduction on tuition costs that they're offering, understanding the economic realities that we're in at this moment. There are also loans and payment plans that they work out with students. So if you are interested in furthering your education and specifically in the field of development studies, then here is your chance. You have to get in touch with them to find out all the details to get started. And then we want to say thank you to Gareth and Fatima for joining us this morning. Of course, these are two of our latest athletes who've been able to acquire scholarships, university-level scholarships, with their athletic talent. Clearly, this is a great opportunity to develop in their sport and also to advance their education. It is so great that we are in this era where young people who invest in their sport and in developing their talent are able now to get access to higher education and even professional contracts as a result. So even more reason why the younger ones can be more dedicated and more disciplined to following through with their sports. But congratulations to the girls, and we do wish you the best of luck. That's all the time we have for today. Remember, if you'd like to contact us, send us an email at oye@channel5belize.com. You can also drop me a line at marlene_oye@channel5belize.com. Find us on Facebook at Open Your Eyes BZ and on Instagram at OYEBelize. Remember to tune in tomorrow morning at 6:30 when you open your eyes to start your morning right. Until then, keep your eyes, your mind, and your heart open. We'll see you soon. Enjoy your day, Belize.
Open Your Eyes was brought to you by the Belize Bank. Our country, your bank.